What is a mid-level? This term gets thrown on a lot, especially by groups who are anti-nurse practitioner and anti-PA. If you've ever been on Reddit, you'll see that it's used in a very derogatory way, but there's a history behind it that many people don't know and accidentally use it incorrectly, or they don't care and intentionally use it incorrectly. So what is a mid-level? First, a little bit of history. So PAs and nurse practitioners were founded in the same year back in the 60s. And as these professions were able to prescribe more controlled substances, they obviously had to register with the DEA. And the DEA considered everyone a practitioner or provider during that time. Back in the late 80s and early 90s, there were two emerging groups. So there were physicians and eventually other entities like them, veterinarians, dentists, podiatrists, who could prescribe controlled substances in all 50 states. It wasn't limited to state-by-state prescribing. They could prescribe Schedule 2 through 5, all 50 states. And then we had other groups, such as PAs, nurse practitioners, animal clinics, ambulance services, pharmacists, etc., who could prescribe certain controlled substances, maybe a Schedule 5, 4, or even 2 through 5, but only in specific states. So that's when they decided, back in 1992, I believe, to separate the two. So you had providers, which were physicians, veterinarians, podiatrists, dentists, who could prescribe in all 50 states, Schedule 2 through 5, and then the other groups who could only prescribe based off of state law, and it varied state by state. So who are all these other groups? Ambulance services, animal shelters, certified chiropractors, or doctors of oriental medicine, euthanasia technicians, homeopathic physicians, medical psychologists, neuropathic physicians, nursing homes, nurse practitioners, optometrists, physician assistants, and pharmacists. Now, you may not even know that some of these entities can prescribe controlled substances in any state, but they can, and you can go through the DEA packet and it'll tell you who can prescribe what in which state. I don't know how frequently it's updated as the legislation continues to change in many states, and in most states, PAs and nurse practitioners can now prescribe Schedule 2 through 5 and have the same limitations as physicians and other ones for acute versus chronic non-malignant pain. No one would ever go to a pharmacist and say, hey, you're a mid-level provider. You have mid-level education, you provide mid-level care. But that's exactly what some of these groups do. They take this term out of context and they basically say PAs and NPs are mid-level providers, they have mid-level education, and they provide mid-level care for patients. That's just a short history on the term mid-level, and it's one of the reasons why PAs and nurse practitioners don't like to be referred to as mid-level. At least PAs just want to be referred to by our profession. So PA, NP, physician.